Top 7 vitamins to heal your nerves. Did you know that nearly 20 million people in the United States alone suffer from some form of nerve damage? And most of them don't even know it until it's too late. What's more alarming is that this condition, known as peripheral neuropathy, often starts in silence. No warning signs, no dramatic pain, just a slow, creeping loss of sensation, a little tingling in the feet, or maybe occasional numbness in the fingers. At first, people shrug it off. However, over time it worsens until walking becomes difficult. Balance feels off, and even simple tasks such as buttoning a shirt become a challenge. What makes this even scarier is that nerve damage doesn't just stay in the nerves. It can increase the risk of falls, lead to chronic pain, and even affect your digestive system, heart rate, or bladder function. It's common in people with diabetes, autoimmune diseases, vitamin deficiencies, and even those recovering from viral infections. And here's the catch. By the time symptoms appear, the damage has already started. That's why early natural intervention is not just helpful, it's necessary. Today, we're talking about something that can truly change the game when it comes to protecting and healing your nerves. The top 7 vitamins scientifically proven to support nerve repair and regeneration. These aren't magic pills. They're nutrients your body already recognizes, and when taken in the right amounts, either through food or supplements, they can help your nerves bounce back, strengthen the communication between your brain and muscles, and even reduce pain and inflammation. Whether you're someone managing diabetes, recovering from injury, or just looking to prevent nerve-related issues, this video is packed with valuable information you don't want to miss. Let's start with vitamin B1, also known as thiamine. Thiamine, also known as vitamin B1, is one of the most essential nutrients for maintaining a healthy nervous system. It plays a key role in converting the carbohydrates you eat into glucose, which your nerves use as fuel. Without enough thiamine, nerve cells can't produce enough energy to function properly, which can eventually lead to nerve dysfunction or even permanent damage. But here's something not everyone knows. Thiamine also directly supports nerve signal transmission. It does this by helping to maintain and repair the myelin sheath, the protective covering that surrounds and insulates nerve fibers. When this sheath is compromised, nerve signals become slower or completely disrupted, which can lead to symptoms such as numbness, tingling, burning, or muscle weakness. A more advanced form of thiamine called benfotiamine has gained attention for its superior absorption and effectiveness, particularly in people with diabetic neuropathy. Unlike regular thiamine, benfotiamine is fat-soluble, allowing it to pass more easily through cell membranes and reach nerve tissue more efficiently. One clinical study showed that patients with diabetic neuropathy who took benfotiamine experienced significant improvements in nerve conduction velocity, indicating that their nerves were sending signals faster and more efficiently. Many also reported reduced pain, tingling, and numbness. Thiamine deficiency is especially common among people with chronic alcoholism, diabetes, gastrointestinal disorders like Crohn's disease, or those who have undergone bariatric surgery. In these individuals, the absorption of B1 is often impaired, and supplementation becomes not only helpful but also necessary. For most adults, the recommended daily intake is approximately 1.1 to 1.2 milligrams, which can be met through foods such as whole grains, lean meats, legumes, and sunflower seeds. However, for therapeutic purposes, especially in cases of nerve damage, benfotiamine is typically supplemented in doses ranging from 300 to 600 milligrams daily under medical guidance. Pairing thiamine with other B-complex vitamins, especially B6 and B12, can enhance its nerve healing properties, as these nutrients work synergistically to support energy production and nerve repair. Overall, thiamine is not just about energy, it's a frontline defender of your nervous system. Next, let's talk about vitamin B6, or pyridoxine. Vitamin B6, also known as pyridoxine, is one of those nutrients that walks a fine line between being incredibly beneficial and potentially harmful if misused. In the right amounts, B6 is a powerful ally for your nervous system. It's directly involved in the production of neurotransmitters like serotonin, dopamine, and GABA, which are chemicals that help transmit signals between nerve cells. These neurotransmitters not only influence mood and stress response, but also play a central role in how the nervous system functions and communicates with the body. Without adequate B6, nerve impulses may slow down or misfire, leading to symptoms such as tingling, numbness, or mood disturbances. Another major benefit of B6 is its ability to regulate homocysteine, an amino acid that, when elevated, has been linked to nerve and blood vessel damage, as well as increased risk of heart disease and cognitive decline. B6 helps convert homocysteine into harmless compounds, reducing its potential to cause inflammation and oxidative stress. In fact, research has shown that B6 supplementation can help reduce symptoms of carpal tunnel syndrome, a condition caused by nerve compression in the wrist. Participants in one study experienced improvements in nerve conduction velocity and a reduction in hand pain and numbness, suggesting that B6 plays a direct role in repairing and optimizing nerve pathways. However, here's where the caution comes in. Unlike some water-soluble vitamins that the body can easily excrete in excess, high doses of B6 over extended periods, typically above 200 milligrams per day, can actually cause sensory neuropathy, resulting in symptoms like burning sensations, numbness, and difficulty walking. That's why sticking to a moderate dose is key. Most people can meet their daily B6 needs around 1.3 to 1.7 milligrams through a balanced diet that includes foods like bananas, potatoes, chickpeas, poultry, and fortified cereals. If you choose to supplement, it's best to keep the dose under 100 milligrams per day, unless advised otherwise by a healthcare provider. And as with most B vitamins, pairing B6 with B12 and folate enhances its effect on nerve protection and homocysteine control. Vitamin B12 is perhaps the most talked about when it comes to nerve regeneration, and for good reason. Vitamin B12, also known as cobalamin, plays a crucial role in maintaining the health of your nervous system, particularly in supporting the myelin sheath. This protective fatty coating wraps around your nerves like insulation on a wire. This sheath is what allows electrical signals to travel rapidly and efficiently throughout your nervous system. When B12 levels are low, the integrity of this sheath begins to break down, slowing or even blocking nerve signals. Over time, this can lead to serious complications such as numbness, tingling, difficulty walking, muscle weakness, and even cognitive issues like memory loss or confusion. The scary part, some of this nerve damage can become permanent if not addressed early. Certain groups of people are particularly vulnerable to B12 deficiency. If you're vegetarian or vegan, your diet may lack enough natural B12, which is found primarily in animal products. Older adults, individuals with low stomach acid, or those taking long-term medications, such as metformin or proton pump inhibitors, may also struggle to absorb B12 properly from food. In these cases, even if you're eating well, you might still be deficient. What's encouraging is that B12 supplementation, particularly in its methylcobalamin form, which is the active version your body can use right away, can make a real difference. A clinical trial on individuals with diabetic neuropathy demonstrated that regular methylcobalamin supplementation not only alleviated nerve pain and tingling, but also enhanced balance and coordination, two areas frequently compromised by nerve damage. This makes BI12 one of the few vitamins that not only protects nerves, but may also help reverse some of the damage. Depending on the severity of the deficiency, doses can range from 500 micrograms to 2,000 micrograms per day, often taken as sublingual tablets or injections for better absorption. For prevention, even lower daily doses may be effective. And when you combine B12 with folate, B9, and B6, the trio works together to lower homocysteine levels, a compound that can harm blood vessels and nerves when elevated. This combination enhances overall nerve regeneration and maintains your nervous system's optimal function. Now, let's dive into folate or vitamin B9. Folate, also known as vitamin B9, is far more than just a nutrient for pregnancy or red blood cell production. It's a key player in nerve repair, brain function, and overall neurological health. Working in conjunction with vitamin B12, folate supports the formation of DNA and RNA, the genetic materials that regulate cell growth and function. But what truly makes folate essential for nerve health is its central role in the methylation process. This critical biochemical pathway regulates gene expression, detoxification, neurotransmitter balance, and most importantly for this topic, the repair and regeneration of nerve cells. When folate levels are low, the body struggles to properly carry out methylation, which can compromise everything from mental clarity and mood to nerve integrity. In fact, research has consistently shown a link between low folate levels and increased risk of peripheral neuropathy, especially in people with chronic illnesses, poor nutrition, alcoholism, or gastrointestinal disorders. One clinical study found that combining folate supplementation with B12 significantly reduced nerve pain and improved motor coordination in patients suffering from neuropathy. This is likely due to their combined ability to lower homocysteine levels, a byproduct of metabolism that, when elevated, can damage blood vessels and nerves. Folate is naturally found in foods such as dark leafy greens, spinach, kale, legumes, lentils, chickpeas, avocados, and fortified cereals. However, not all forms of folate are created equal. For supplementation, the preferred form is L-methylfolate, the active bioavailable version of folate that bypasses the need for conversion in the body. This is especially important for individuals with MTHFR mutations, a common genetic variant that reduces the body's ability to convert folic acid into its usable form, leaving many people unknowingly deficient, even with a balanced diet. The daily folate requirement is typically around 400 to 600 micrograms. Still, in therapeutic settings, such as for managing nerve pain or supporting recovery from neuropathy, higher doses may be used under medical supervision. As with other B vitamins, folate works best when paired with B12 and B6, forming a trio that enhances nerve protection, promotes regeneration, and maintains balance in methylation and homocysteine levels. Vitamin D might not be the first thing that comes to mind when discussing nerves, but emerging science reveals it plays a surprisingly significant role. Vitamin D may be more well known for its role in supporting bone health, but its impact on the nervous system is equally critical and often overlooked. Vitamin D receptors are actually present throughout the brain and spinal cord, suggesting that this nutrient is deeply involved in neurological processes. One of its most important functions is reducing inflammation in nerve tissues, which is a common factor in many types of chronic pain and nerve disorders. But even more fascinating is its ability to stimulate the production of nerve growth factor, NGF, a protein that helps repair damaged nerves and supports the regeneration of nerve fibers. This makes vitamin D not just protective, but potentially regenerative when it comes to nerve health. Large-scale population studies have drawn a strong connection between low vitamin D levels and higher rates of diabetic neuropathy and chronic pain syndromes. In one study, patients with diabetes who had deficient vitamin D were significantly more likely to report symptoms like numbness, tingling, and burning in their extremities. And it doesn't stop there. Another clinical trial found that supplementing with vitamin D led to improved nerve conduction velocity and decreased pain scores in individuals with peripheral nerve injuries. That means signals traveled faster along nerves, and the overall pain experience was reduced. Clear signs that healing was taking place. So, how can you get enough? The most natural source of vitamin D is sunlight, which triggers its synthesis in the skin. Just 15 to 20 minutes of direct sun exposure a few times a week may be enough for some people, although factors such as skin tone, geography, and age can influence this. In your diet, look for fatty fish like salmon and mackerel, as well as egg yolks and fortified foods such as milk, orange juice, and cereals. For most adults, a daily intake of 800 to 2,000 international units is a good target, with vitamin D3, cholecalciferol, being the preferred form due to its superior absorption and longer-lasting effects. In cases of confirmed deficiency, especially in those with chronic nerve pain or neuropathy, higher therapeutic doses may be recommended for a short time, but always under medical supervision to avoid toxicity. Let's not forget vitamin E, one of the most powerful antioxidants your body has. Vitamin E plays a crucial yet subtle role in nerve health. While it doesn't often make headlines like some other vitamins, it's essential for protecting your nerve cells from oxidative stress, which is one of the leading causes of nerve damage and degeneration. Every time your cells produce energy or respond to environmental stressors, they create free radicals, unstable molecules that can damage cellular structures, including nerve tissues. Vitamin E acts like a shield, neutralizing these free radicals before they can cause harm. This antioxidant defense is crucial for maintaining the integrity of the myelin sheath, the protective covering that surrounds nerves, allowing signals to travel quickly and smoothly. But vitamin E's benefits don't stop there. It also helps preserve the structure of cell membranes, keeping nerve cells strong, flexible, and well-functioning. Additionally, it promotes healthy blood circulation, ensuring that nerves receive the oxygen and nutrients they need to repair and regenerate. When your nerves are well fed, they're more resilient and able to recover from injury or inflammation. It's no surprise then that vitamin E deficiency often presents with neurological symptoms such as poor coordination, muscle weakness, vision issues, and even balance problems, especially in people with conditions that impair fat absorption, like cystic fibrosis or Crohn's disease. Scientific studies back this up. One research trial found that vitamin E supplementation significantly improved both motor and sensory nerve function in people suffering from neurological disorders, including peripheral neuropathy. The improvements were likely due to its potent antioxidant properties, which helped reduce inflammation and support nerve cell survival.